Welcome to the final week of Nurses. We are so pleased to recognize and celebrate the extraordinary work of nurses in healthcare systems worldwide. If healthcare is to work, it takes nurses. And we realize and appreciate that each of you make a difference. Following the ANA 4-week model, we are pleased to welcome you to community engagement. Again, each nurse who participates today and for whom we have an email address will receive a PDF copy of the award-winning book, B is for Balance, 2nd edition, an ANA first place winner in consumer health. Today's panelists are 4 professionals, 2 of whom launched our first session. While it may be the final week of Nurses Month, you, we, and our panelists know that every single day is Nurses Day, and that nurses, as the most trusted healthcare professionals, 22 years running, should be acknowledged every single day. Let's start with our guests. Dr. Bob Dent. Dr. Bob Dent is Vice President, Patient Care, and Chief Nursing Officer for 2 hospitals within the Emory Healthcare System in Atlanta, Georgia. Bob is a past president of the American Organization for Nursing Leadership. With a career spanning 3 decades in business and operational roles, he has combined his expertise in nursing and leadership to author 4 books, book chapters, many journal articles, and presentations related to culture, improving workplace environments, interprofessional collaboration, and nurse staffing. Welcome, Bob.
Thank you. Appreciate it.
Kim Evans, who will be joining us, I hope, is an advanced practice nurse with about 40 years of clinical experience in multiple roles, including staff nurse, nurse manager, and critical care clinical nurse specialist. Kim is a certified advanced registered nurse practitioner in adult health. She completed a fellowship program in integrative medicine through the University of Arizona with Dr. Andrew Weil in 2006, and she's active in the Holistic Nurses Association. Welcome to Kim when you're on board. Claire Biedenharn brings over 2 decades of chaplaincy experience in industry, critical care, and more. An author, teacher, and speaker, she seeks to guide stressed healthcare providers, does that sound like any of us, toward a restored relationship with the profession. Currently, Dr. Claire leads a pilot program with Health Carousel that provides listening services to nurses. Welcome, Claire.
Thank you.
And Antoinette Montalvo is a true visionary. As a coach and mentor, she supports nurses and other professionals, healthcare and non-healthcare, in their personal and professional vision and life planning, leadership development, and innovation goals through workshops, seminars, and coaching. A warm welcome to each of you. Dina Redinger is my co-host. She is not with us today, but I do have her permission to go ahead without her, and let's make this work. We have been blessed to have so many of our viewers participate in the discussion. We welcome that today as well. Let's begin with today's panel of experts and a few questions. I'll ask, you folks respond. You can ad lib, you can add to the discussion, and let's move the conversation along. So first of all, how can nurses build community engagement, forge connections, and encourage good communications, especially around population health? Somebody want to start us off?
Recently, I did a journal article with 2 others about stories, the power of stories that based on COVID. It was at the IHI website. And in our study, we discovered how what a blow public health took during COVID. And I think that nurses have a remarkable opportunity to help restore that connection with public health, because I think the public doesn't quite understand what public health is. And what a remarkable opportunity with all that y'all bring to nursing, but to be able to get out in the community and to be a bridge between that scary hospital stuff and preventative care so they don't have to end up in the hospital.
Well, I like that as a startup. I wonder if, Bob, you'd like to build on that. And could you also define for us, what is public health?
So yeah, I agree with Claire and everything she's talking about on the public health side and what nursing can do. I had the opportunity a few years ago to do a humanitarian mission in Bolivia. And so in Bolivia, as an example there, they were having issues with rabies and dogs, they run all over everywhere. Well, the nurses took it upon themselves to help protect the citizens within Bolivia by doing the vaccine, the rabies vaccines themselves to help improve the community's health in that regard. And so nurses took it upon them to do that. I think here, as we think about what's happening within our communities, nurses can play a significant role in public health outside of the hospital. I have a good friend, I think everybody may know Tim Porter O'Grady, but he said something years ago to me that stuck, and he goes, an admittance to the hospital is a breach in the healthcare system. And so if we think about, those patients that are coming into the hospital as a breach to the healthcare system, what can we do in our communities to help our community members to be more healthy? And I think that's where, when we look at our community health needs assessments and others, how do we gauge what our community needs, and being vocal within our boards and other kinds of things as well.
That's interesting. Antoinette, welcome. Do you want to build on that? We're talking about the whole concept of how nurses can build community engagement, forge connections, and encourage good communication. And Claire started us off with saying the public doesn't understand public health.
And hopefully you can hear me okay, and hopefully the sound's not too echoey.
No, you're good.
Okay, great. So I'm actually in my local library, where I've been doing a lot of recent work in terms of population health and community health. So I love these kinds of conversations. I love being able to talk about these things, especially as a community health consultant. I've said it before, probably in some of our other lives, it's one of my love languages, talking about community health and population health, because I think nurses have a prime opportunity to be present in these kinds of conversations. A lot of the things that I focus on is looking at the community as a patient. We very much can apply the same skill set that we do to a patient population to how we look at the community and how we look at the populations, because a lot of these things are kind of on those macro level situations, right? We're looking at the big picture issues. And I think nurses are prime for that, because you see what's happening day in and day out. We see what's happening day in and day out on an individual level. And then we're able to translate that to say, what's further upstream. I think there's an image that goes around that in terms of, what's upstream that's causing whatever the downstream issue is, right? You may see that there's a trickle of water that's happening in a stream in a community, but what's blocking that stream, further down the way? Are there stones? Are there barriers? Are there issues that are there? And so nurses seeing, some of the initial micro issues that are happening in a patient's life can also say, let me trace further upstream. It's what we do best in care coordination. It's what we do best in innovation. So being able to take some of the downstream issues and look upstream and say, what's blocking that? What are some of the barriers? What are some of those social determinants of health that may not allow my patient to access the care the way they need to, be able to, receive the medication they need to? What's going further on in order to access that health? So I think nurses are already ready and already available, especially in the way of advocacy. And so just being able to apply that to seeing, again, the community, the population as that patient, and saying, where do I need to go further upstream so I can think about these systems issues and make sure that when that patient accesses whatever the care they need, we've already addressed some of the things that might be blocking it to begin with.
If I can just add to that,
Please.
And I love that, Antoinette, what you're talking about there. I'm in the Atlanta area, and work with Emory Healthcare. So we work closely with Grady, which is our only level 1 trauma center in the area. They have a really good gun violence prevention program. And so they, when you think about it from that perspective and learning there, well, Edna Briscoe, she's our chief nursing officer at our Emory Hillendale campus, which is in Stonecrest, Lithonia. And so we, our CEO at the time, and Edna, went to the DeKalb County commissioners and was able to get a large multi-million-dollar grant to build a program like that at Lithonia and Stonecrest at Hillendale. What they found is that we don't need to replicate necessarily what Grady did and do a prevention-like program. So what they're developing is an interruption kind of a program. So how do we interrupt it? And that's what Antoinette was talking about, those upstreams and what is happening to the downstream. And so they're looking at a program to go into the schools and work with with our youth in the schools and the community, and really try to interrupt that part so it doesn't get to gun violence necessarily, and to be able to do that. But it does take nursing engagement in that sort of work.
Well, I absolutely agree with you. So I want to build on that. Should nurses who are very involved in social media, should they be leveraging social media to engage in community work? And if yes, how do they begin? How do they get started?
I think absolutely. And obviously there's many different ways to do it without being concerned. Well, I shouldn't say without being concerned, but doing it in a way that's respectful, that's tasteful, that protects patient, profiles and information. And I think a lot of it is just highlighting the work that they are doing. It may not necessarily be in a community or in a hospital setting, but it may be in a community setting. So maybe some of the health education that's done. And again, I love these kinds of questions, but it's very much the track that I've had to take. When I first, launched my community health initiative, and when I first kind of branched into business as a consulting coach on the community health side, social media was such a great avenue because it gave me an opportunity to highlight some of the needs that were in the community. So a lot of what I started with was highlighting, here are some needs in my local community that have to do with vision and hearing screenings. Those were basic things and basic issues that were happening in the area. And as a result of that, there were other people in that community that had resources that could connect to those who needed additional vision and hearing screenings. And so that social media piece, it's the ecosystem that we're in right now. It provides a connection. It provides an opportunity to not only showcase, I'm in a very rural area where people may not necessarily come to this rural town where I'm at, but they can showcase and highlight some of the issues that are in those rural areas versus in urban areas like Atlanta. I love Atlanta. I went to Emory University for my undergrad. I did not stay because of the traffic, so I had to leave as a result of it. But you need to kind of be able to combine those things. So I love these kinds of opportunities like what you're hosting right now, Sharon, being able to combine resources, being able to see, what are some models that are happening in other places and how you can highlight those models in the same places that may not be as reachable, that may not be as accessible, that may not have everything around. And so I think with social media, nurses can leverage it the correct way to highlight some of the issues that are in those areas, but also leverage the resources that might be around them so it can elevate, places and spaces that may not get as much attention to begin with. And so I think it's a great opportunity if you use it right. And it's a great opportunity to connect and network and learn. And I've definitely seen that firsthand in the work that I've gotten a chance to do as well, too.
Okay. Does somebody want to build on that?
Well, I just wanted to say, I think that in our day and age, the way the importance of social media in so many lives, that it's a wonderful place to start because Dr. Google says, everybody goes to Dr. Google, but having that social media presence gives healthcare, public health, a little more credence. It's like this, and this is something specific people can understand. And also with social media, you're using their language.
Right. What percentage, just off the top of your heads, what percentage of the public do you think gets their medical advice from either Dr. Google, who is prepared at the terminal level, or from WebMD? How many people go there first to explore the
100%.
symptoms, to see what's going on?
I think everyone in some capacity at some point has either Googled or WebMD something. Whether it was correct or not, whether it was the best option or not, I think in some capacity, if people truly want to admit it, have at some point researched something through the internet because it's got all the tools and resources. Now, do you hang your hat on it? No, you don't hang your hat on it. But I can tell you definitely from direct patient care opportunities and clinical care, there were many people who were like, I Googled this thing when they start off. They always say, I Googled this thing, I looked up this thing. Sometimes it may give them a little bit more information. Sometimes it may lead them down a rabbit trail, but it's the beauty and, some of the drawbacks of internet, Google and everything else that has to do it, nothing against Google. It's a great resource. But I definitely think, we have a lot of information at the touch of our fingertips. And so sometimes we want that information in the wee hours of the night. The mom who was up crying because her baby is crying and she doesn't know who to turn to. And so she's looking for some type of resource or outlet. It's very easy to say, let me just look it up and see, am I the only one that has, gone through those types of things? So.
Okay, so full transparency, have any of you ever Googled or used WebMD to ascertain what to do next in your own lives? I'm sorry, Bob, and then you can continue. Have any
I
of
think,
you ever done it?
so yeah, I have. I'm just trying to think at what, just in the last hour, maybe, no. But but along with that though, and what is emerging and what people are moving towards, I heard a keynote presenter at the American Organization for Nursing Leadership earlier this month, and talking about AI. And so I'm looking at AI, ChatGPT, and others, just to type in a simple question and be able to get the answer you need, within 3 seconds, really. And so I think people are going to be using more AI kinds of things, driving some of that work as well.
I think you're right. I saw somebody this week who used AI to create her intro when she was speaking, which I thought was a little strange. They made her sound very strange, which is even worse. We want to at least sound like who we are.
Right.
Yeah.
And I think with that, as it applies to, in the same concept of community engagement and using, social media and those types of things, it's the reason why when you have certain health sites, that they request that you be a certified provider. If you look through, certain, Mayo Clinic or anything else, if you're looking at certain articles, past WebMD or some of the other articles, they have the person's credentials at it. It's why health writing has exploded as a big resource, because they are, recruiting nurses, recruiting physicians, recruiting those healthcare professionals who can provide credible information because they know people are going to be looking for it. And so it's not to say that any of them don't have credible information, but it's just knowing what applies to your particular situation. So, it's why we have smartwatches that have, you can get your blood pressure on it, you can get your heart rate on it, you can do all of it. And so it's not so far-fetched at this point. It's just knowing, again, as you said, what to do with that information. It's the importance of why community engagement is important. It's why community health is important. It's why population health is important still, so that it helps people know what to do with the information that they have. I've said this before, as a pediatric nurse practitioner, if I could educate every parent on what I knew, they would probably be able to come to their appointments a lot more informed and a lot less stressed. Because again, it's about the information that you have access to. So being able to deliver that information in a way that's tangible and receivable, it keeps people more informed so that they can receive the care that they need to receive in a timely manner.
So Antoinette, on the smartwatch, I just heard yesterday in our professional practice council, we had 2 patients that were admitted just in the last couple of days. Both of them, their smartwatch told them they had atrial fibrillation. One of them has a history of atrial fib and was in atrial fib and was admitted. The other one was new onset atrial fibrillation. So and so you thinking about the technologies to advance public health is an important part of that.
But I think one of the most important parts of that, and our mutual colleague Bob Anne-Marie Brooks and I decided we were going to the Apple store together to learn how to work our smartwatches, because the watches are smarter than us. So if you haven't gone to class and you don't really watch a video, you don't know how to do it, it becomes perhaps more of a hazard than maybe help. I'm not sure. Or do you always need to have a 10-year-old by your side?
Well, I think that's where the beauty of where, kind of to your first question, Sharon, about nurses, where they need to be, right? In terms of population health. Have a nurse at your Apple store. Have a nurse in the company. There's a lot more rise that's happening. Microsoft has a chief nursing officer. There's a lot of organizations that have nurses at the forefront. I think it's a great time for nurses and healthcare professionals to really be present in those moments, so that you don't, kind of go down a place that you don't need to go, but then also that you continue to keep people informed. I think it's just being innovative in how we think about where we can be present. There's lots of conversations, especially for me as a coach and mentor, that nurses talk about, and many people, about burnout, about sustainability, about being able to do something different with being at the bedside if they may want to shift. And that's the beauty of nursing. You can be in many different environments, but thinking very much out of the box of where you can insert yourself in a local library and being a resource for your local library or wherever you end up going. But it's it's needed everywhere. Health is everywhere at this point. So wherever health is and healthcare is needed, that's where a nurse needs to be, for sure, in my mind.
Okay, I want to pick up on that a little bit with another question. So we talked about community health, we talked about community engagement. How have you personally become involved? Think about a call to action. And Bob, you talked a little bit about what you've done there locally. Think about a call to action for nurses, either at a grassroots level or formally within an organization such as ANA or maybe your specialty society? How about a faith-based organization? That's right up your alley, Claire. A healthcare facility or a nonprofit where your skills and knowledge add value. How do you make a difference in those kinds of grassroots or fully organized local level groups?
Well, one thing is I would say that, we come to this role with a certain, we've been assigned authority by the public. I just wanted to say that, in that survey every year, the nurses come out ahead of the ministers.
22 years.
Number one. Y'all are number one. I mean, at least ministers are over used car salesmen, but so I think that having that, coming with that authority. And so I use my skills, not directly in patient care. I'm really involved in animal rescue. And what I do is I'm kind of a counselor to the staff at the animal shelter, because sometimes they have to euthanize animals and it is never easy for the staff. So that's just one way I've kind of elbowed my way into being able to work beyond traditional setting.
Okay.
So
Anyone else?
Yeah. So, here, me, one of the things that, I help organize, I establish our Diversity, Equity, Inclusion Council for the 3 hospitals here within that are within Emory Healthcare. And within that, there's a whole work group just on community engagement. And within that community engagement, looking at those social drivers of health and that we're serving in our hospitals, how can we address diabetes, high blood pressure, those kinds of things. And so our community engagement team is we're always out in the community, and that is whether it's in churches, schools, there's a whole host of different kinds of places where our nursing staff, our medical staff, and our teams are really trying to meet people where they are and trying to do some education and understand what's going on and how do we advocate on their behalf. I think Emory as a whole, and this is not uncommon to most hospitals across the country, but Emory as a whole, when you think about it from a community engagement perspective, have given back more than $800 million over the course of a year in support to the community. And some of that is, in charity care that comes to our hospitals, but a lot of that is put back into the community and how do we embrace or help our community patrons.
So a lot of people say that, yes, they'll come to church, but they'll only stay if you or your nurses bring the food, bring the lunch, serve something. Is that true? Will they only stay if there's food, or do they stay and engage with you anyway?
So for us, I mean, what we're seeing, and I've got a whole list of different churches that we're involved with. And I was on one of the first in which we brought many of the preachers and pastors and church leaders together and had a conversation about this, kind of creating this shared vision about what we want for their people within their congregations and what we want to do for health of their members of their congregations. And it became a shared vision in there, similar with some of the other community types of organizations. There's a lot of people doing a lot of things, and nobody knows about what they're doing necessarily, or we don't know what the other person is doing. And so part of it is creating that sense of community that, hey, we've got a lot of resources available. How do we promote each other to advance the health of the people within the community?
So then is it a multidisciplinary team, or is it nursing only?
No, it's a completely interdisciplinary or interprofessional team of people who get together. I mentioned Edna Briscoe. She's heavily involved on that community side, along with a chief quality officer for that community. We've got pastors or people of our spiritual health department and many others who are part of that community engagement team. They help create those relationships, the relationships there, and set up those programs. And then they invite a lot of people to them, and we do get a lot of people that show up and are truly interested in what's being taught.
Right. So my husband is a hospital CEO for many, many years in Chicago. I think that one of the highlights of his professional career was being awarded the Reverend Martin Luther King Keeper of the Dream Award for his work with the churches on the south side of Chicago. It was a huge, huge honor. And
Yeah,
we both were deeply touched by it. It was, and I went to church with him many times as well. They invited him to come and speak from the pulpit, not to give the sermon, of course, because you never give someone who loves to speak a mic or you'll never get it back. But just to be able to add information about what the hospital was doing, what was happening at Michael Reese, what was happening wherever.
Yeah.
Just to build on that a little bit, last week, we have what's called Leadership DeKalb. And so DeKalb is DeKalb County. And in DeKalb County, it's a leadership development program or leadership enhancement like program. And they bring 30, 40 leaders from across the community into and understand what's going on in the community. So I had the opportunity to moderate a panel on mental health. And so we had a psychiatrist, somebody from NAMI, a psychologist, and then a nurse practitioner. And so I got to moderate that there. And one of the parts there was not only to educate the leaders of the community, because they sit in pretty good places, but also challenge them to what they can do to address the social drivers of health within our community as well.
Oh, I like that. Because
Yeah.
mental health clearly is a huge issue. It's not just the physical symptoms that people are looking for.
Right.
If they've had an encounter or an interaction with a friend and they're worried about that friend, they're going to look things up. They'll go back to Dr. Google, right, Claire?
Yeah. And I think a lot of it I resonate with everything that is being said. It's just, the trust factor. In order to meet people where they are, as you said, and I love that because I always use that as well, is that you have to establish that trust. So I think being available to listen, to learn, to understand what the needs are. One of the biggest things that even drove me to start the community health initiative that we did on a grassroots level was that specifically in the community where our church is, there was a lot of people that were having complications from diabetes that was uncontrolled. So
Right.
members losing limbs, some type of necrosis that happened. And it was recognizing that, health goes again, it's physical health, it's spiritual health, it's mental health, it's every single aspect of it. When you look at that person as a whole person. So as you establish that trust, as you understand what the community's needs are, people want to see change. They want to see people get better. They want to see people healthy. I think over the last couple of years where, there were many churches that were not as accessible as they used to be prior to, the pandemic, many pastors, many ministers still wanted to serve their community in some way. So, there were a lot of drive-through food drives that happened. There were health fairs that happened outside the church building. There were ways that people's needs still needed to be supplied where they may not have been able to congregate as they usually were able
Exactly.
to. And so it was recognizing that, again, going where people need to go, meeting people where they are, establishing cross-sectoral collaboration and establishing that trust are those big ingredients that are needed to be able to advance and be able to advance care in certain communities.
Thanks for raising that issue, because I remember, I'm sorry, Claire, driving by a couple of drive-by early morning mass here in the Maryland area. It was no question. It was just expected. Go ahead, Claire.
Well, I was just going to say too that, as addressing that inherent trust, when you're working with somebody's faith background, it's someplace familiar, the leaders are familiar, as compared to walking in the ER and going into some hospital where the biggest fear is to get the band on, take off your clothes and get the band on your wrist and become a number, and how powerful it is to use that faith-based pool of talent. And like I said, it's an inherent trust.
And food may initially draw people, but they still stay for learning as well too. I've done many a health education sessions in churches where we talked about, managing diet, managing nutrition, and, people want snacks. Obviously, you want to be fed both physical food and spiritual food inside your church. But then also they stay because they realize, again, you're caring for me across the spectrum. You're looking to see that there's many different pieces to me. And again, it's another way of helping people feel informed, being able to get the information that they need and working with that. So.
Good. We have a lot of listeners today. Benjamin has been real active in the chat. He had lots of questions, lots of good laughs. Benjamin, do you want to unmute yourself and make a comment or two? Add to the conversation? Thank you. Hi.
As always, it's a pleasure to be seeing all of you. And actually, I communicated with some people to join this event, and I told them just listen to the conversations. But what's good about the topic for tonight about community engagement, especially in nursing education, this has been within the nursing programs, particularly in nursing curriculums. Although it's kind of becoming more formalized in a form of service learning. So the students are doing service, but at the end of the service, the students need to reflect on the service that they have provided, because this is really where you are helping the students to develop their social responsibility, civic responsibility. It's also a way for the students to, as mentioned in some of the books, to soften the nurse's heart. By being engaged in these kinds of activities consistently. And I can give an example, like 2 weeks ago, within the last 2 weeks, we were involved with a lot of activities in the community. But the framework that we utilized, because this is something that is, like a topic globally, sustainable development goals. So there are a lot of areas where nurses can contribute in terms of education, in terms of trust, diversity, peace building, so many different areas where nurses can be involved. So from last week, we have done activities such as educating pregnant mothers. There are also a group of master students who provided education to the public about substance abuse. There are also other group of students also did an activity related to mental health. So this has been something that is and should be honestly leveraged in nursing programs, because I feel like for nurses to become more of an advocate, or probably to strengthen their advocacy skills or global advocacy skills, leadership skills, and health policy, I feel like that this is something that nursing education really need to look into.
Okay. Lorna, would you like to add to that? Lorna Kendrick? Or Mohammed, who is a student from Kansas? Lorna, go ahead.
You know what? I probably don't have much to add at this point. Thank you for asking and calling on me. I got distracted and I was doing something else. So I'm going to let someone else.
It's not a problem. It's not a problem. Anyone else want to add to the conversation? Please feel free to raise your hand or unmute yourself, and let's do that. We'd love to hear from you. That enriches the conversation and gives us all great takeaways.
So just to add, one, I appreciate, Benjamin's comments there about engaging, students and School of Nursing. What I'm seeing and hearing is that, I think if we're going to do generational differences, and some of the younger nurses are wanting to see and to be more engaged from service kinds of activities. And so I think there are opportunities for that. As an example, there's a collaborative between Emory University School of Nursing and Emory Healthcare, and which we support our nursing teams to do international health mission trips. And so there's opportunities for that. And when I'm rounding and I'm visiting with our teams, what they want to see is more, and they talk about it, more opportunities for engagement. And so that's what, from a magnet perspective within hospitals, and we understand magnet, the test of time on that, and they tend to do better than non-magnet hospitals. But in the structural empowerment aspect of that includes community engagement. And so our team's really working with our DEI Council on community engagement to get more nurses involved in those. And so being aware for those opportunities that our nurses can engage and when they want to engage is really good.
Okay, I'd like to share a comment from Hamida, who is a nursing student, who says, for me as an MSN student and within my profession, I can share this in growing my awareness. Nursing education and help in communication and collaboration with other disciplines helped me to learn the needs in the nursing program in relation to the community needs. This will help deliver overall better quality care within the community. I think he was responding to what Benjamin said. I'm in a place where all the lights just went out. He is my mentor and great educator. I can't imagine how much invested from our professional relationships, emphasizing the integration of nursing advocacy and nursing education, and how amazing this is when it trickles down to the student. So his work environment also requires input to serve patients in medical and surgical settings, as well as in the community health. I really like that. Thank you.
Sharon,
Yes, go ahead, Rajitha.
thank you. I just would like to add to that. Bob, I work at Emory Healthcare and I'm a health coach too.
Oh.
As we can see in this day of age, we are very short of nurses on the floor. And that being said, being short already under that high stress level, and you're going into a patient's room who is already sick and with high stress vibrations there, they don't know what's coming on. So those are the vibrations that we are passing on to our patients instead of healing vibrations. And I am hoping, as this shortage over time, improves as we have more nurses, we will be able to make a difference in our patients, not just a checkup of administering medications, doing your assessments, because we are so focused on the wow, where we have to document versus that touch, making that patient feel comfortable that it's okay. We understand you where they are. That's a big piece that's lacking. And I'm hoping we can bring that in and help our patients, not just with the medications, but helping them really talking, about their health coaching. How can they prevent the next event? Integrating both of the components. That would be my dream come true when I see that if we can bring both of them together to help in helping our patients improve their health and well-being. Thank you.
So it's okay. Rajitha, how long have you been at Emory and what brought you to Emory?
I have been at Emory for the last 10 years. First, I started off at Midtown for 5 years. Now I'm at Johns Creek. Initially, I started as the dialysis and then utilization review, now in case management. So I see full circle in case management, when patients come in. So again, there is that little line, I try to step my boundaries into my health coaching, try to coach them. I'm like, okay, no, try to do that little bit of coaching wherever I meet those patients, especially in the ER, you see them diabetics coming in. They don't even know that they're diabetic. That's the first time they have encountered. And even the ones that do know that have insurance cannot afford. They come in because I can't afford to take my medicine. But emergency room is the answer? No. So these are other things that we really need to think about as a community to help our patients. Not just about, yes, medications are are helpful for their improvement, procedures, surgeries, but we need to integrate, a holistic way of improving their health, and talking to them about that.
We're running short on time, but I want to mention something. Bob wrote a tremendously wonderful post this morning on LinkedIn that dealt with the whole concept of staffing challenges. We all face staffing challenges. He brought it back from a historical perspective in terms of how long we've had these. And I never really gave it that much thought because I came from a school of nursing background where the students were the ones who staffed the hospital. And so therefore you didn't think so much. But when I started to do the math and think, when I first worked at the American Hospital Association, there were over 300 schools of nursing, and then suddenly they were gone. But 300 schools of nursing with an average of about 150 nurses each, that meant a lot more nurses in the pool. But we don't have that anymore. It's not quite the same thing because obviously nurses as students, even if they just have a cap on their head after 6 months, can't be the charge nurse. It doesn't quite work that way. it's not real, it's not realistic. But I'd like to draw your attention to that article. I'd like to also close with a question that says, does the shortage of nurses, the fact that we have a lot of problems recruiting people, limit our ability to engage with those in the community?
So answer that, go ahead.
It's a big question in thinking about, how we conclude that. But I think the big piece is that I think there are a lot of willing nurses, but you have to be willing to utilize them in the way that they need to be utilized. There might be nursing shortages in a variety of different areas. And sometimes when we think about the traditional settings of nursing at the bedside in the hospital, there are staffing shortages. There is a lot of pressure. But I think if there's a way to redistribute nurses who would like to stay engaged, but in different capacities, then you can meet that need so that you don't have as much pressure when it gets to the acute care setting. So thinking again, that upstream motion of, what's going on in primary care, and then a step further, what's going on in prevention, and then a step further, how can you better educate the society in general from, a policy standpoint, from a general community standpoint, from, a departmental standpoint, all of those different types of things. So I think if you are able to, maybe there may be retired nurses that aren't going to go back to the bedside, but they love to do policy work. Maybe they'd love to be an advisor in a community. Maybe they would love to do something that's other than the very, taxing process of being at the bedside. I'm not saying that people aren't able to do that, but I think it's being able to recognize that there can be a growth process in the nursing profession, and that you can grow along the spectrum of nursing.
And transition. So let's hear from Bob and then Sheila, and then it is in fact time for a close. Go ahead, Bob.
No, I think I think now's the time to double down on public health and community engagement by our nursing staff. As I mentioned that more, you referenced the article I wrote this morning on LinkedIn, but there's projections of anywhere from 600,000 to 1 million nursing shortage by 2030 alone. And so we really have to think differently. And going back to
that name
Brady said is that the admittance to to a hospital is a breach in the health system. How do we take and leverage, as Rajitha was talking about, our nurses to make a difference and maybe do more prevention kind of work in that public health setting and addressing social determinants of health?
Absolutely. And Sheila, let's hear from you.
So, yeah, can you hear me?
Yeah, absolutely.
Okay. So thank you. This is a great discussion. And I want to kind of build a little bit about, what Antoinette was saying, and also all of you have said, there is opportunity for growth within the nursing profession. So within the last couple of years with the COVID, the transition to telehealth, we've had so many nurses that have learned to become experts at telehealth. And that is a very effective way of being able to interact with people that are not just, because of COVID, but also because we have a lot of people in the community that are not mobile, and it's awkward to be able to get in, and having the technology, making sure that in some of these communities, we've provided people with the technology so that they can be accessed by their healthcare provider is really important. I think one of the things that really kind of hit me hard was I was talking to somebody about hospitals that are, they're so taxed right now with not having sufficient nurses. So they have a lot of agency nurses or people who are not used to working on certain units. And so they, in one case, what they've done is they have a more senior nurse, an experienced person who's kind of supervising virtually, and that the staff nurse goes into the bedside and she's a temporary nurse and she really doesn't know things. And so she can contact this, virtual guide who then tells her what to do, or him what to do in terms of delivering the patient care. So I see a lot of challenges with that. I see challenges in terms of the degree of communication, if there's any technology things. But what I thought about was, it seems like a way to approach it, but what about really intense training, something really effective to train these agency nurses so that they're not so kind of just hanging out there. They get assigned to a unit, they get sent up, they get very little training. And then for them to be dependent on, this virtual support person. I mean, imagine being in the bed and you've got a nurse who's having to dial in for help to be able to provide you care.
Right.
A little bit intimidating, I think, for the patient. So I think I'm, looking at, I think there's opportunities to develop task forces that would really help create meaningful, education for some of these nurses, and then have some kind of a follow-up. If we used a process where after every interaction, we really found out, did the patient actually get what they need? And it's just over the last few months, I've been in a lot of clinical settings, and I will tell you, it is pretty scary, the stuff that doesn't get done. So I think there's a
Thank
lot
you
of
for that, Sheila.
Yeah.
Thank you for that. We could go on in this discussion for like the
All right.
next
Thank
3
you.
hours.
All right.
However, it is time for a close. We'd like to thank you for joining our series. Dina and I truly appreciate you and celebrating nurses and nursing with us. If you'd like some more information, please feel free to visit smwgroupllc.com to learn about our learning center and how you can glean new skill sets and advance your own career through communication, leadership, and core values. Don't forget to provide your email to dina@acecoachingco.com to receive a free PDF copy of the book. We want to thank you, our panelists, for all 4 weeks, and especially today, for being a part of Nurses Rise, the ultimate Nurses Month celebration. Enjoy the rest of your day, your experience, and be grateful for the nurses in your life, including yourselves. Give yourself a great big thank you. Take care. Enjoy the rest of your day. Thanks, Bob, Claire, and Tanette. Appreciate you.
Thank you.